Did you know that by 2022, medical assistance in dying, or MAID, accounted for about 4% of all deaths in Canada? This is roughly 1 in 25 Canadians choosing an assisted death. Since the legalization of MAID in Canada after 2016, the practice of it has grown rapidly. This raises a key question. What are the effects of medical assistance in dying on healthcare, society, and cultural perspectives in Canada? Medical assistance in dying is defined as either voluntary euthanasia or doctor-assisted suicide performed by a qualified medical professional. In simpler terms, it is a process where a doctor or nurse helps someone, at their request, to end their life. Medically assisted death involves a carefully planned, precise process, and the most common method, the first drug used, is typically midazolam, a fast-acting drug that induces deep sleep. This places the patient into a peaceful, coma-like state within minutes. Next, propofol, a powerful anesthetic, is administered to deepen unconsciousness and ensure that the patient feels no pain or awareness. Finally, neuromuscular blockers are given to stop organs. This sequence ensures that the individual passes away without physical suffering or awareness of this process. These medications are commonly used in surgery and critical care, so they are well understood. MAID can be provided in one of two ways: clinician-administered, where a physician or nurse directly administers a lethal medication, or self-administered, where the medical practitioner prescribes medication that the patient takes themselves. Either way, strict eligibility rules apply. A person must be an adult, capable of making healthcare decisions, have an incurable medical condition, make a voluntary request without outside pressure, and give informed consent after being fully informed of other alternatives. This law has evolved since 2016. That year, Bill C-14 was passed to legalize MAID under those initial criteria. In 2021, Bill C-7 was passed, removing the requirement that natural death be reasonably foreseeable. How many Canadians actually use MAID under these rules? In 2019, there were 5,631 reported MAID deaths in Canada, which is about 2% of all deaths. By 2022, it jumped to 13,241 cases, 4.1% of all deaths. That represents a steady annual growth, about 26% per year up to 2019, and then even larger increases through 2021 and 2022. In 2023, the growth rate slowed somewhat, but there were still 15,343 MAID deaths, up by 15.8% from 2022. In total, since MAID was allowed, nearly 45,000 Canadians have received it. Let's go deeper into the statistics of people receiving MAID. According to Canada.ca, in 2019, 51% of all MAID patients were men and 49% women, with an average age of about 75. Over 80% were 65 or older. 2/3 of the cases were because of cancer, followed by chronic organ failures and neurological diseases. Importantly, most MAID patients also receive palliative care, which aims to improve the quality of life for individuals and their families. Throughout the years, about 80% of MAID patients had been in palliative care. This shows that MAID in Canada is generally not a substitute for palliative care. In fact, the majority of patients are receiving comfort and support measures even as they choose MAID. Some view palliative care and MAID as opposing perspectives. Palliative care focuses on relieving suffering without urgent death. Yet, data shows palliative care is frequently involved in the process. Most patients choosing MAID have received palliative care alongside their decision. To properly understand what everything meant for healthcare workers, I spoke to a registered nurse who was directly involved in MAID cases. Here are some thoughts that she mentioned. I still remember the first MAID patient I cared for, back when it had just been legalized in 2016. She had end-stage COPD and couldn't breathe without an oxygen tank. She told me life wasn't just enjoyable anymore. She had given up her cat, couldn't play with her grandkids, and was scared that if a blood clot in her neck moved, she might have a stroke and lose the ability to make her own decisions. She didn't want to become a burden to her family. The procedure of MAID was done in the hospital. The doctor came to confirm everything and made sure that she hadn't changed her mind. The medications were the same as those used in surgery. She just fell asleep, and then another dose stopped her heart. It was peaceful. Not everyone at work agrees with maid. One of my coworkers stayed outside crying because she believes our job is to save lives, not end them. But no one is ever forced to be involved. Personally, I think it is a blessing in certain cases, but you have to be really careful. It should never be influenced by depression or financial stress. It has to be the patient's true choice, and only when there's no more quality of life and no better option left. Another healthcare effect is on the training and comfort of providers. Early on, many doctors and nurses had never participated in euthanasia, and as a result, many were shocked or reluctant. Over time, experience is spreading. Studies have interviewed physicians who provided MAID, finding a range of unexpected experiences, from emotional gratification in ending suffering to moral distress over patients in pain before death. Medical education now increasingly includes MAID in their ethical curriculum. Clear practice guidelines have been developed on the drug protocols and sedation methods, and pharmacies now stock MAID drugs. All of these changes reflect it becoming a normal, if still highly regulated, part of end-of-life care in Canada. What about the cultural aspects? Multiple surveys show that around 3/4 to 4/5 of Canadians approve of MAID. For instance, a 2023 poll found that 84% of Canadians supported the decision allowing MAID, and 78% supporting removing the reasonably foreseeable death requirement. Strong majorities, around 80 to 82%, supported eligibility for severe mental illness. Importantly, the polls also show that most Canadians think publicly funded hospitals and care facilities should offer MAID if they have the staff and equipment. In short, MAID is broadly accepted as a legal choice for many patients. But there has still remained ethical and cultural debates. Some patient and disability groups have raised fear that the legalization might apply soft pressure on vulnerable patients to end their lives. One report shows that attention should be focused on enhancing care and minimizing suffering, rather than broadening euthanasia eligibility, with a call for careful protections to prevent devaluing anyone's life. International context also affects Canadian perspectives. Belgium and the Netherlands have had broad euthanasia laws for decades, even for non-terminal suffering. Canada's decision to delay certain acts, including mental illness, was to allow time to learn from those countries' experiences. In fact, psychiatric euthanasia cases abroad have raised questions about slippery slope risks. Canadian experts have studied Dutch and Belgian protocols, which involve rigorous psychological assessments and waiting periods to design safeguards. For now, mental illness as a sole basis is on hold until 2027. Religious and philosophical views also shape cultural debate. Most mainstream Canadian faith leaders have expressed caution or opposition to MAID. Many religious organizations have said MAID conflicts with the principle of the sacredness of life, urging instead that the care team support the dying through suffering without active killing. In contrast, other Canadians emphasize more on compassion and personal choice when faced with incurable pain. Canada's main law includes a respect for conscience. Healthcare providers who object to MAID for moral reasons are not forced to participate, but they are legally required to provide an effective referral to a willing provider. Policies aim to try to strike a balance between individual autonomy and respect for life, as originally outlined in the law's objectives. The 2016 bill introduction had goals such as declaring the inherent and equal value of every person's life, while allowing autonomy for those suffering. This balance means some hospitals or doctors will not be involved in MAID, while others will, due to their varying perspectives. In summary, medical assistance in dying in Canada is a carefully regulated health service that has become increasingly used since its legalization. We have now seen tens of thousands of Canadians use MAID, typically older cancer patients, often with substantial palliative support. It has forced hospitals, doctors, and nurses to confront their values and practices around death and autonomy, causing debates about ethical considerations and autonomy. Society has largely accepted MAID as a legitimate choice, but not without discussion of the ethical and cultural implications. Public policy remains active. Federal and provincial governments continue to monitor usage, refine laws, and invest in supportive care. The Canadian experience shows a trend toward recognizing assisted dying as a part of the healthcare landscape, while also highlighting that its broader effects require ongoing attention, dialogue, and care.